Thank you, Mr. President. Mr. President, in recognition of Prescription Opioid and Heroin Epidemic Awareness Week, I am here to convey the urgency of responding to this crisis. Ladies and gentlemen, we are coming to the point of no return in this national discussion of opioid addiction. Between 2013 and 2015, the United States saw an increase of more than 8,000% in the amount of synthetic opioids like fentanyl seized by the United States Customs and Border Protection. But wait, it gets worse. The Massachusetts State Police Crime Laboratory tells my office that from 2013 to 2015, the number of items seized by law enforcement that tested positive for fentanyl increased by 10,000%. We are watching as this Class 5 hurricane is making landfall. And unless we do something to stop it, we will watch fentanyl lay waste to community after community all across the United States of America. Fentanyl is the Godzilla of opioids. It's stronger, it is deadlier, and it is coming to every family in our country unless we do something now. Between 2013 and 2014, more than 700 deaths in the United States were attributed to fentanyl and its components. That's for the whole country. But according to the Massachusetts Department of Public Health, as of last month, unintentional opioid overdose deaths in my state since January has skyrocketed. From January to the end of June, there were 488 confirmed cases of fentanyl overdose opioid deaths in my own state alone. There were only 700 deaths in the whole country from fentanyl between 2013 and 2014. Fentanyl has now been confirmed in 2/3 of all of the overdose deaths in Massachusetts so far this year. It was 57% of the deaths last year in 2015. Now it's up to 66% of the deaths. Many drug users overdose on fentanyl because they have no idea that it is mixed into whatever substance they are injecting or whatever pills they are swallowing. They do not realize just how deadly it is. It also poses a serious threat to the men and women who are first to respond to the scene of an overdose. If the powder is absorbed into the skin or accidentally inhaled, it can be deadly, making our first responders especially vulnerable to the drug's harmful effects. Just last week, 11 members of a SWAT team fell ill after a bust in Connecticut where they encountered deadly fentanyl. We know that Mexico and China are the primary foreign sources of illicit fentanyl and for the chemical building blocks from which it is made, and then trafficked into the United States. The business model for those who manufacture and sell fentanyl is simple. Fentanyl is cheaper, fentanyl is more potent, and fentanyl is more addictive than heroin. We must make stopping the trafficking of fentanyl into the United States from Mexico and China one of our highest foreign policy priorities. We must elevate it up to what we are trying to put together as a plan to fight ISIS. We must put it up there with a plan to ensure that we protect our jobs from copyright or trade infringement. We must elevate this importation of fentanyl to the very highest level of foreign policy concern in our country. I was pleased to see reports of recent cooperation between the United States and China in combating fentanyl trafficking, including a commitment by China to target U.S.-bound exports of substances controlled in the United States, and an agreement to increase the exchange of law enforcement and scientific information that can lead to coordinated actions to control substances and chemicals of concern. And we are improving information sharing on heroin and fentanyl between our government and Mexico. Next month, Mexico, Canada, and the United States will meet for a North American drug dialogue and focus on commitments to develop a North American approach to combating illicit opioids, including fentanyl and its precursor chemicals and analogs. But there is so much more that we must do. Fentanyl is an overseas invader of a different kind, but it is equally deadly. We must continue to elevate the fight against fentanyl and make it one of our highest national and international priorities. I have introduced a Senate resolution calling for cooperation to stop the trafficking of illicit fentanyl from overseas. It is a bipartisan resolution with the support of Senator Rubio, and I thank my friend Senator Shaheen for co-sponsoring as well. Our resolution expresses the sense of the Senate that the United States government and the governments of Mexico and China have a shared interest in and responsibility for stopping the trafficking of fentanyl into the United States, and all of those three countries should develop joint actions to attain that goal. I urge my colleagues to co-sponsor this resolution and to recognize the grave seriousness of the challenge illicit fentanyl poses to our country, and to make stopping the trafficking of that drug into the United States a national priority. And let's be clear, stopping the overprescription of opioid pain medication that is fueling addiction to heroin and fentanyl and countless overdoses starts with the prescribers. We need to require anyone who prescribes opioid pain medication and other controlled substances to undergo mandatory training on safe prescribing practices and the identification of possible substance use disorders. We need to make sure that people who entered the judicial system don't arbitrarily have their Medicaid coverage terminated, making it more difficult to access treatment once they are released, and as a result, fueling the vicious cycle of re-incarceration. We need to make sure that all opioids approved by the Food and Drug Administration are first reviewed by independent experts to ensure that those drugs are not only safe and effective, but also won't continue to fuel the epidemic of addiction in this country. We need to make sure that prescription drug monitoring programs are fully utilized and nationally interoperable in order to prevent doctor shopping, where one doctor doesn't know that another doctor has already prescribed, where one person moves from a state to another state with multiple doctors who are prescribing the same prescription drug. That must end. We must let Big Pharma know that their army of lobbyists will be matched by an army of advocates that work every day to raise awareness and to save lives. In Boston, there is an area of our city called the Methadone Mile. It is approximately 1 square mile, and it is the location of methadone clinics, safety net hospitals, and homeless shelters. It is also home to those struggling with addiction, those receiving treatment for addiction, and the litany of saints and angels who are providing the desperately needed services for those suffering from mental health and substance abuse disorders. It is a 1 mile, one-stop shop for hope and ground zero in the battle against addiction in Boston. Here in Washington, We are at the epicenter of the money mile. It's both an area where big pharma's lobbyists toil with the task of ensuring that even during this storm of prescription drug, heroin, and fentanyl overdose deaths, the deluge of prescriptions for opiate-based painkillers goes unabated. According to a story out this week from the Associated Press and Center for Public Integrity, the pharmaceutical industry spent more than $880 million nationwide on lobbying and campaign contributions from 2006 through 2015. That's more than 8 times what even the NRA and the gun lobby recorded for activities during that time period. When pitted against the money mile, the methadone mile doesn't stand a chance. Money mile and its army of big pharma lobbyists are the reason that mandatory prescriber education is not the law. It is the reason that the Food and Drug Administration has been, in many instances, complicit in the worsening of this epidemic. Without real funding for opioid addiction treatment, the methadone mile and all the other areas in cities across the country will continue to drown in overdoses and deaths. Our cities are fighting a war, and we need to help them. Throughout Massachusetts, people are growing angrier and angrier by the day. They are frustrated by the lack of response to this epidemic by Congress, and frankly, so am I. The deaths caused by this epidemic are growing exponentially every single year. But the only thing that outpaces those deaths are the empty promises of funding made by this Congress. I believe history will judge this Congress by how we responded to the prescription drug, heroin, and fentanyl epidemic that is devastating this country. We have little more than 100 days left in this Congress to do the right thing. 100 days to show the American people that partisan politics will not impede our responsibility to respond to what may ultimately become the greatest public health crisis of the 21st century in the United States. The United States Congress has an opportunity to let all those who are struggling with addiction know that help is on the way, to know that we have heard their stories and that we will not forget them. We must let them know that no matter how dark life seems right now, that there is hope and that sunlight will grace them once again. Treatment works. Recovery is possible. But this Congress must provide the funding for that treatment, for that recovery. We must fund the $1.1 billion the President is asking for the opioid crisis in our country. We can no longer turn a blind eye, a deaf ear to that request. Families all across our country desperately need this help. There is a terrorist that is across the streets of every city and town in our country. It is this opioid epidemic. It is a terrorist that is more deadly for those families than anything that could ever affect an American that is going on in Aleppo. It kills 30,000 people a year, and the numbers are growing on the streets of our country. We know what the cause of it is. We know that more treatment is needed for those who are already affected. It is the responsibility of this Congress to provide that funding. As we now talk about a continuing resolution, the Republicans still refuse to talk about funding for this opioid crisis. If we do not deal with this issue, we do not deal with the public health crisis on the streets of our country right now. I urge every member, regardless of party, to listen to the families of this country, to listen to those who are suffering, who need help, and are looking to us to give them the assistance which they need. These family members are heroes, but heroes need help. They're turning to us. And so far, we have not given them the help for the treatment and the recovery programs which they need. Mr. President, I, at this point, yield back the balance of my time.